So for my project, I came up with my own mnemonic. My mnemonic is obviously old octopuses teach tiny angelfish about great volcanoes sitting above home. So that is my mnemonic that I came up with. And this next poster board is telling you what nerve it is, the classification, and the function. So nerve 1, which I had obviously, this is the olfactory nerve. It's a sensory nerve and the function is smell. And then for nerve 2, it's the optic nerve and I put old. It's a sensory nerve again, and then for the optic nerve, it's vision and then perla. And then for nerve 3, it's the oculomotor, and I had octopus. It's a motor nerve, and the function is eyelid elevation and pupil size and reactivity. And then for nerve 4, which I had teach, it's the trochlear nerve. It's a motor nerve, and the function of the trochlear nerve is the eyes turn downward and laterally. And then for nerve number 5, which I put tiny, it's the trigeminal, if I'm saying that right, and it's the classification, it's both a sensory and motor nerve. And then the function of that is it's chewing, facial and mouth sensation, and corneal reflex. This is what we were taught with our head to toe assessment of having the patient close their eyes and touch various parts of the face. And then nerve number 6 is the abducens nerve. I had angel for that, and then it's a motor nerve. And then the function of the abducens nerve, it's to turn the eyes laterally. And then for nerve 7, it's the facial nerve. I put fish for my mnemonic. It's both the sensory and motor nerve. And then nerve 7, it's facial expression, taste, eyelid, and lip closure. And then nerve 8 is the acoustic nerve, which I had about for my mnemonic. It's a sensory nerve, and then it's used, the function for the acoustic nerve is hearing and equilibrium. And then nerve 9 is the glossopharyngeal nerve. It's both sensory and motor. And then it's the gagging, swallowing reflex, and taste. And then nerve 10, vagus nerve, it's both sensory and motor nerve again. Again, gagging and swallowing reflex, but this is speech. And then nerve 11, it's the spinal accessory nerve. It's a motor nerve, and this is shoulder and head movement, and then rotation. And then the last nerve, the hypoglossal nerve, it's a motor nerve, and it's tongue movement and speech. So obviously old octopuses teach tiny angelfish about great volcanoes sitting above home. Then I have one more poster board. Again, telling you what nerve, but how to assess the nerve for function. So for nerve 1, olfactory, you can have the patient identify a familiar scent with eyes closed. When we do our head to toe assessment, we have our patient close their eyes and we just wave an alcohol thing in front of their nose and they have to identify it. Optic, nerve 2, have patient read card one eye at a time, have patient read your name tag. And then to test visual acuity by having patient cover one eye, focus on nose, and identify number of fingers you're holding up and the 4 quadrants. Nerve 3, the oculomotor, you can assess that nerve by checking pupillary responses with pen light. You're going to check accommodation by moving finger towards patient nose. And then check EOMs by having patient look up, down, laterally, and diagonally. And then nerve 4, trochlear nerve, have patient look down and in. Nerve 5, trigeminal, have patient close their eyes and touch various spots on face, like I was saying. And then patient will hold mouth open while you close it and move jaw laterally against hand. And then the corneal reflex, you can touch the cornea with a wisp of cotton and the patient should blink. The abducens nerve, nerve 6, ask patient to move eyes side to side. Nerve 7, the facial nerve, and then ask patient to smile, raise their eyebrows, keep eyes and lips closed while you try to open them. Ask patient to identify salt and sugar placed on tongue for taste. And then nerve 8, which is the acoustic nerve, you can rub your fingers near each ear and the patient will tell you if they can hear it. Nerve 9, the glossopharyngeal nerve, touch back of throat with sterile tongue depressor and have patient swallow. And then vagus nerve, assess gag and swallowing reflex with the glossopharyngeal nerve. And then for the vagus nerve, you're also going to assess vocal quality. Nerve 11, the spinal accessory nerve, have patient shrug shoulders and turn head from side to side. Last nerve, hypoglossal nerve, have patient stick out tongue and move it internally from cheek to cheek, and then assess articulation for speech. And that is what I have for my cranial nerve memory tool project. Thanks.